Hello class, in this brief video I'm going to review how to do the Health Illness Belief Assessment. It is worth 225 points or 22.5% of your grade. It is a tool, so you are not writing a paper, you are filling out the tool which is listed here, and I will go through that in a minute. So what you need to do for this assignment is download the instructions and rubric and then the tool. I would print the health instructions out and the rubric, and then this you can download, type on it, and then you would save it and resubmit it. So the first thing you need to do is look at the instructions, and you really don't need to put this up here because you're going to be handing in the tool. So what you're going to do is you're going to interview a person. Doesn't have to be a patient. It could be a person or a patient. If you're in a clinical setting, you might want to consider one of your patients and let them know you're going to actually be sitting down and talking to them. I would get an okay from your instructor, or you could interview someone else. The biggest thing you need to do is they need to be from either a different culture or they need to be from a different religious background. So as an example, it could be you're Caucasian and you might interview someone who's Hispanic or from another culture, another country, or you could be of the Jewish faith, and you could interview someone who is of the Christian faith, or Muslim or something like that, but it does have to differ. So you will be filling out the tool, which we will go through next, and what you're going to do, and this is very important in this tool, is you're going to assess what the person believes in, their own thoughts, and then you're going to compare it to your thoughts, and then in the end you're looking at how does this knowledge help you in nursing, understanding that everyone has different thoughts and values about different aspects of caring for themselves. So make sure that you use the tool, which I will open up in a minute or two. And then in each of the boxes, you will see that this is what you need to be asking for information. And I'll go through that criteria because it's listed in each of the boxes so that you can see how that looks in the tool. Again, you use the tool, do not write a paper. You need to include 2 scholarly references, and usually I like to see something besides your textbook. Again, everything needs to be in APA format and rules of grammar, spelling, and word usage apply. So that is the instructions for that. Then we need to go back and open up the tool. And here is the tool that you will be downloading and using. So in this column is going to be the person or patient that you interview, and then you're going to compare it to yourself. So you can put your background, religious background, age, gender, that type of information in here. Then you go to the next one, and you're looking at who is the family, the person you're talking to, go to for help. Who do they consult for information and assistance related to health needs? Sometimes it's a family member, it could be a friend who's a physician, it could be the head of the church, or if it was Native American, it could be the leader or the chief. So you put that information in there, and then in this column, you're talking about yourself. So what is your beliefs related to the patient support system? So you might consult someone different, have a different aspect or attitude about it, and then you're going to compare your thoughts and how do your thoughts differ from the patient's, or maybe they're exactly the same, but you're going to write a little synopsis here. Next one is, what is the patient's perception of personal level of wellness and illness? So that's looking at how does the person view health and illness, wellness. They might be very adamant about exercise, thinking it's very important. Um, what do they think is important? Healthy eating, maybe it's not important. What is their perception? And then over here, how does that relate to your beliefs, your beliefs, and then how does that influence your perception of that person? So as an example, you might talk about, this person may think that eating dairy products and meat 3 times a day is is appropriate. And over here, you would probably expand on that a little bit. In this column, then you would talk about your beliefs about that, and then how does it compare to the patient's beliefs. So again, what you're doing is you're looking at interviewing a person, their perception, does it differ from yours? And how does that influence? Because in the long run, how is that going to influence when you care for people who have different values or beliefs? So in this one, what are the patient's beliefs or concerns related to hereditary issues? And then you're comparing that person's beliefs with your own concerns and beliefs. And again, how would that affect, possibly affect caring for that person? What would trigger a visit to the healthcare? Could be some people might use the urgent care center frequently, may see that as a means to access health care. And your beliefs might be that you would never go there. You'd call your family physician or would not use that or whatever. But again, you're comparing the patient's beliefs, person's beliefs to your beliefs and how they are alike or how they differ. What type of healthcare provider would the patient seek for primary care? Again, access to care, doctor, no doctor, nurse practitioner. Is this what they want to be doing? And again, comparing to your own beliefs. When would they visit a healthcare provider for pain? And then this is a discussion about pain and what would trigger a visit if there's pain related. And again, compare it to what you think is your own feelings about that and how does that, are they similar or are they different? Mental health, sort of the same track. What is their perception? Make sure that when you are answering this, that you answer each one of these questions. And when I get to just looking at the rubric, that I'll tell you why that's important. So finally, you're going down the list of personal, familiar, culture, religious beliefs which impact food choices. And again, especially if you're doing different culture, that is usually an area where you'll see a difference. And what barriers does the patient perceive in accessing care and compared to your beliefs? And then here is your summary. How might the knowledge of this patient's beliefs impact your own plan of care? And in doing this assessment, how has that made you possibly more aware of your own thoughts and feelings about patient care? How will you change possibly to provide more evidence-based patient care? Down here are your references. And you again need to have 2 scholarly references. So now if we scroll down, here's your rubric. Remember in these rubrics it has missing 1 element, missing 2 elements. So when you look at the first one, it has 1, 2, 3, 4, 5 elements that you need to have in that first column. So if one of these is missing, that's where you could lose your points. Again, here you have discuss the patient support system. Who who does a patient consult? What are your personal? So you have 3 elements there, and they need to be described in an appropriate and thorough manner. So when you see these different questions, you know that there's at least 2 or 3 things in each question that you do need to answer. So as you scroll down, just make sure that you are including all that information so that you do receive full points for each area. Format again is citations would have to be in APA format, and you have minimal 2 references. You use the tool, and it's always a good idea to run your paper through spell check. So I'm going to show you an example of a paper that did get a good grade. So the student used the tool, and she compared herself with a person who was of Jehovah's Witness, and the student was a member of the Church of Jesus Christ of the Latter-day Saints, and went down through the whole paper and talked about what the person she was interviewing was experiencing, and then how it compared to her, and then her thoughts, and then how it compared to her. So we can scroll down to the bottom of this tool, and at the bottom you'll see that she has 3 references, and they are in proper format. So she included citations within her work and ended up with a very good grade. So if you have any questions about this, please feel free to put the questions in the Q&A session or Q&A discussion, so that everybody who sees your question maybe has that same question. So please let me know if you do have any questions. Email me or feel free to call me.